Revision hip replacement. Over time, the original components of a total hip replacement can break down and loosen from the bone surface they were once firmly attached. Revision hip replacement involves the exchange of some or all worn components with new ones. The degree of complexity for this procedure is dependent on the amount of loosening and associated damage to the underlying bone surfaces that may have occurred over time. Specialized components, bone graft, and cement may be used to rebuild the hip joint. An incision is made along the side or in front of the hip. In most cases, the previous incision for the primary hip replacement is used. The muscles, tendons, and joint capsule are moved away from the joint to expose the femoral head and acetabulum. The hip is positioned to expose the joint. The old femoral and acetabulum components are removed, and the respective surfaces are cleaned out in preparation for the new replacement components. The new replacement components are carefully and precisely secured into position. Cement may or may not be used to secure the stem. A carefully fitted ball is secured to the end of the femoral stem. The hip joint is then rejoined, and all surrounding tissues are repaired back to the normal position. Compared with the original procedure, and due in part to the complexity of the revision, some patients may be slightly restricted with motion and activities following a revision hip bone surgery.